The next wave we're looking at as we continue talking about the ECG is a T wave in electrocardiography. Now, the T wave in electrocardiography, what we'll be doing is defining the T wave, showing you guys pictures having the T wave, right? Then we'll go on to talk about the normal T wave. Then next we'll be talking about the abnormal T wave, right? And what it means. If you have an abnormal T wave, it actually indicates that there's an abnormality, right? So that means that there's a disease condition that is underlying. So we want to actually know the disease conditions associated with what? Abnormal T waves. So the T wave in electrocardiography actually represents what? Repolarization of ventricles. Now let me tell you guys why they call that like that. So looking at this, the QRS complex is what? The depolarization, right? So repolarization starts from the ST segment, alright? Because S is like the last part of the depolarization. So repolarization starts from ST segment up to T wave, okay? So it represents repolarization. That's when like the ventricles are relaxing to get filled with blood again, which is actually what? A recovery phase of the ventricular muscles after contraction, right? So what are the characteristics of a normal T wave? Morphology, it is asymmetric, it is round and upright in most leads. This is a T wave, upright, is round, right? Duration is usually between 0.16 to 0.24 seconds. Amplitude varies by leads, but generally about what? Less than 5 millimeters, right? So you can see the normal, in as much as it goes high, it will be less than what? 5 millimeters. Axis, it is concordant with the QRS complex. Like after the QRS complex, you find it, all right? So looking at the abnormal T wave now, if the T wave, instead of being up, it is now down, all right? Then there's a problem. Is it T wave morphology? All these ones are what? Abnormalities of T wave, or of T wave, right? So inverted T wave is when the T wave, instead of being like about 5 millimeters, it is now even lower than what? 1 millimeter. So that means what? The T wave what? Inverted like this instead of being upward like this. This indicates myocardial ischemia, coronary artery disease, or any cardiac strain. Alright. Then a flat T wave. This one is just a flat line. Right? It's not up to 1 millimeter still, but it's not inverting, it's just straight like this. Right? Indicate myocardial ischemia, coronary artery disease, or cardiac strain. Then a tall T wave, that one is more than the usual 5 millimeters that we have. It indicates hyperkalemia, that's elevated potassium levels in the body, or any cardiac condition such as what? Left ventricular hypertrophy. Alright. So T waves inversions in leads with upright QRS complexes. This indicates myocardial ischemia, coronary artery disease, or cardiac strain. So you could see what? The possible disease conditions are likely to be linked with what? Any abnormalities in the T wave, right? So we have them compiled here. So myocardial ischemia, coronary artery disease, cardiac strain, hyperkalemia, left ventricular hypertrophy, or any cardiomyopathy can be related with what? An abnormality in the T wave morphology, right? So that's it.